Respiratory compromise is common, costly, and deadly. And I'm here to demonstrate why Microstream capnography matters when it comes to improving patient safety and outcomes. There are many potential causes for respiratory compromise. Asthma, hyperventilation, chronic pulmonary disease, and airway obstruction are just a few examples. Monitoring oxygenation and ventilation gives clinicians an early indication of respiratory compromise and is vital to helping improve patient safety. Capnography monitors measure exhaled carbon dioxide and calculate respiration rate, the number of breaths per minute. A sampling line captures the exhaled breath sample from the patient's nose or mouth and sends it to the capnography monitor to measure ventilation adequacy. The pulse oximetry sensor provides an indication of the amount of oxygen in the blood. The monitor also calculates the patient's respiration rate and heart rate. All these measurements combined give clinicians a complete picture of a patient's respiratory status. So, how does it work? Let's watch capnography monitoring in action. Here are my healthy values. Now let's see what happens when I stop breathing. When a patient stops breathing, or if breathing is compromised, the normal exchange of gas in the alveoli of the lungs is disrupted. Capnography and pulse oximetry monitoring measure this exchange of gas in the alveoli. And I'm back. As we've just seen, the Microstream capnography monitor provided an early indication that my breathing was compromised. Capnography and pulse oximetry are both important measurements and, when used together, provide clinicians with a complete picture of a patient's evolving respiratory status. This is critical because early detection of respiratory compromise can lead to earlier intervention by clinicians and improved patient outcomes. Because patient safety is vital, Microstream capnography matters. To learn more about the Microstream technology advantage, visit our website and watch the video about respiratory compromise.